Hi, my name is John Eberhardt. I am a manufacturer rep and a respiratory therapist for International Biophysics, the manufacturer of the AffloVest. When you pull the device out, there will be a battery that looks just like this, that's going to be separate, that you'll put in this little pocket, battery pocket, and there will be a digital controller that has some bubble wrap around the digital controller that you'll take off. The battery itself is a 2-hour battery. Once you receive the device, it'll be about half charged, so you'll need to charge it up completely after the first use, or really right when you get the device. If you wanted to plug it in and charge it up the rest of the way, that would probably be the best thing to do. So once we get the vest on, with the 3 buckles, you want to snug the straps up, just so that it's snug enough to not be uncomfortable, but snug enough so that the motors are hitting your lung wall or your chest wall firmly. Okay, and as you use the vest, your level of comfort will change a little bit. Right now this is extremely comfortable. I might be able to cinch it down as I get used to the therapy as the days and weeks go by. The vest itself has shoulder straps as well. And to set these shoulder straps, the best way to do it is to sit down in a chair and then buckle these shoulder straps down. You don't have to sit down when you do this therapy. That's one of the real benefits of AffloVest therapy, is it's mobile during use. So you can use it while you're gardening, and you can use it while you're doing the dishes or the laundry or taking a walk, or that's one of the big benefits of AffloVest therapy. This is a digital controller that comes with the AffloVest. On the digital controller, there is a power button on the top left-hand side. When you press that button and hold it down for 3 seconds, the device will turn on. You'll see the LED light up. On the LED on the left-hand side is the therapy modes, P, V, and D. P stands for percussion, V stands for vibration, and D stands for drainage. On the right-hand side, you'll see high, medium, and low. High correlates with 20 Hertz, medium correlates with 13 Hertz, and low correlates with 5 Hertz. Also on the digital controller, there's a button that says Go on the top left-hand side. This button is a programmable button that is set by the manufacturer, but can be adjusted by your DME provider. So how you're going to use that Go button is when you initially get set up on the vest. Probably the best thing to do until you really know what you like and what works for you is to turn the vest on with the power button and then hit Go. That button will take you through all 3 different therapy modes on medium for about 10 minutes. So each therapy session will be 30 minutes, and that is the goal. We want you to use the device for 30 minutes twice a day, a typical prescription. Sometimes your physician will order it slightly differently, but typically it's 30 minutes twice a day. And then these are just buttons that take you around the digital controller. On the bottom left-hand side, you'll see a button that says Program. That's how your DME provider is going to set the Go button. And on the bottom right-hand side, you see something that says Usage. That's your hour meter. It's going to be important for you to know how to get into the hour meter so you can read how many hours are on the device, just in case your physician is looking for compliance, how much you're using the device per day, so that they know you are benefiting in using the device. So I'm going to go ahead and turn the vest on so you can hear how it sounds. All right, we're going to start the vest on percussion, on high. Okay, this pause play button at the bottom is how you start the vest. If you want to just use it on its own, if you want to just set your therapy yourself. So you can hear the motors, all 8 motors turning off and on, off and on. This is percussion. This therapy mode is typically used to help secretions move up the airways more readily. Okay? It allows secretions to rest against the lung wall and then be moved forward. Rest against the lung wall and then be moved forward. so it moves secretions pretty well. Okay? Vibration, which is the second therapy mode, has all 8 motors operating at once. Okay? This is a real popular therapy mode. People like this a lot. It really does a good job. This is vibration on high right now. So this is literally as loud as the vest will ever get. If the device is fit to you appropriately, like this one is for me, this is as loud as it gets. You'll hear like you're talking into a fan while you're wearing your vest. Perfectly normal. But it is more aggressive than it sounds because there's all 8 motors, there's 8 waveforms that are really creating turbulence in your lung fields and moving those secretions around. Okay? So that's percussion and vibration. And then drainage. Drainage is a therapy mode that will take secretions from the outside of your lungs or from the far portions of your lungs or the bases of your lungs, and it will move the secretions into the center of your lung field to the larger airways so you can actually cough those secretions out. This is a very important part of AffloVest therapy. Any vest therapy is fantastic as long as you are coughing, okay? Once the secretions get to an area where you can cough them out, 3 or 4 times during your therapy session, you need to actually take a deep breath and cough. If you need to learn how to do effective techniques for coughing, you can talk to your DME provider, and they will help you learn what to do what's called a huff cough, which is a slightly more effective way of actually getting the secretions up and out. The battery on the right-hand side is a 2-hour battery. Okay, the charger on the battery here is here at the bottom. Okay, that's the plug-in for the battery, and this is what your charger is going to look like when you pull it out of the bag. Plugs directly into the wall, into a little converter box there, and then plugs directly into the bottom of the battery. Okay, you should charge your vest once a day, once every other day, because it's a 2-hour battery. It tends to work for at least 2 days. So if you charge it once a day, you will never run out of juice. If you do ever run out of battery, the device will run and charge at the same time. So you can plug it into the wall, sit in a chair, lay in your bed, and actually do your therapy while you're charging the battery at the same time. It sort of takes away some of the benefits of AffloVest therapy, because what we want you to do is, if at all possible, use the device while you're moving around and doing your activities of daily living. There is only one way to void your warranty. There is a zip tie at the bottom of this U-shaped zipper on the inside of the vest. This is in place to make sure that patients and or providers don't open up the vest and mess with the motors or the internal workings of the vest. If this zip tie is broken, the vest warranty is void. The warranty on the device is a 5-year warranty, so if anything happens to your vest while you have it, the manufacturer will cover the device up to 5 years. If anything happens to your vest afterwards, then your DME provider will take care of that for you as well. Okay? So just reach out to your DME provider and they will actually help manage that for you. All right? That is the AffloVest. That's simple as that. Follow your doctor's prescriptions, and we're hoping that you're able to get your lungs a little bit more clear. When you're in the need for some airway clearance, clear your chest with AffloVest. Thanks so much.